everyone. Hey, how's it going? I'm Dr. A, and today I'm going to talk about mask wearing when we can finally drop the mask, and also just a little blurb about the COVID-19 vaccine. So I'll start with the COVID-19 vaccine. Again, as you see in the media and all over social media, people are talking about the COVID-19 vaccine, and with good thoughts. It's like, we hope that the vaccine is safe. We hope that things haven't been like put together so quickly that efficacy and safety have gone by the wayside. And again, but there's also that sort of fear that if I take this, is it going to make me worse? Is it actually going to make things better? And for other people, it's like, hey, hopefully I can get this and get back to having a normal life in 2021 and just writing off 2020. So my thoughts on about it are that I guess I'm getting more confident about it the more that I hear about it. Uh, is one of the fears we had, or one of the things that concerned me, was how quickly the whole thing was put together. But you also have to realize that COVID-19 is the COVID or coronavirus that was found in 2019. There have been other coronaviruses out there, and people have already been trying to make vaccines against the other coronaviruses that are out there. So they already had basically a base or a model or something to study in order to direct this new vaccine or new series of vaccines that all these other companies are coming out against the current COVID-19 um, virus itself. So in that sense, those are one of the things that help it become produce a lot more quickly. Another thing too is that a lot of times it's hard to get money to fund a lot of these studies or to fund the creation of vaccines, and also hard to get people to convince people to say, hey, you know what, I want to go ahead and take a vaccine that hasn't really been proven, and it's hard to get people in those studies. So with this one, it's like they actually got about 48 to 50,000 people who pulled their shoulders up, rolled up their sleeves in order to take the vaccine to sort of test it out before it actually went to further production or went to further clinical trials to be reviewed and now going into production for us to get it as well. Versus the usual studies where you really only get maybe 2 to 3,000 people. So again, you've had almost like 10 times the number of people who've gotten tested beforehand, um, who they've administered beforehand and studied before it came to the marketplace. So again, even with all those things, it's like I'm a little bit worried about it. I'm not gonna lie. I think I'm going to get it just based on the $1 million question that you really have to ask yourself is like, do you think that COVID-19 or anything that you can get from the COVID-19 vaccine is worse than actually having the COVID-19 virus? Again, any vaccine you get, you're going to have hopefully smaller reactions than you would if you actually got the full dose of uh, from being infected by the actual virus or whatnot. Just like the flu vaccines, like you may have some pain in your arm. You may feel like you have a little bit of the sniffles, a little bit of a cold, but you're not gonna have the full-blown flu. And at least what I've heard from some of my friends who actually gotten the vaccine, some other friends in medicine who got it, is that some of them got absolutely nothing. Some felt like a little down, but felt fine for like a day or two afterwards or so. But nothing near as bad as actually having COVID-19. At least what they've told me. And I guess what I've also seen in the media is that there have been people who've had like Bell's palsy, which is facial droop. But again, it's been a small number of people, and usually that's something that's reversible. So at least for me, I feel more confident and more comfortable getting the vaccine. I do want to get back to having a normal life at some point in time, hopefully in the near future. Just know that you getting the vaccine doesn't mean that you can't infect anybody. So again, when you get the vaccine, you can still get COVID-19. You just hope that you stay away from the severe symptoms. So supposedly the vaccine is supposed to reduce your chance of having severe symptoms by 95%. So again, there's still a small chance that something can happen. And also, again, if you happen to get it, you can still transmit it to other people. Hence, us having to still have to wear masks and social distance until enough people have gotten vaccinated. And we've done enough with the mask wearing and testing and everything else we've been doing to help really burn the virus down, to really decrease the incidence or the chance of you coming in contact with someone out in the environment, and really making those numbers really, really low. So again, that's just a little blurb about the COVID-19 vaccine. Again, it's something that I think I'm going to go in and roll my shoulders up and roll my sleeves up and go in and get. Again, you can always give me your thoughts on it. But again, I would never tell anyone, say, oh, you have to get this, you have to. It's like, well, I hope you do, just because I mean, it seems like the studies, be it that there aren't like long term studies on it. It seems like it's safe, and I feel like anything I can do to one help myself and not get COVID, help my parents and my other loved ones not get COVID-19, and also help us as a society in whole get out of this pandemic. I mean, would be a good thing. But anyway, give me your thoughts on it. I'll talk to you later. Again, it's Colin Dr. A. Or signing off.